Pacific Edge is an oncology diagnostics company founded and headquartered in Dunedin, New Zealand, with offices in Hershey, Pennsylvania, that makes diagnostic tests for detection of bladder cancer. Roughly around 2008, 2009, there was some seminal work published on the use of RNA biomarkers in urine by the team at Pacific Edge. And it was really from that point that we became a urine biomarker focused company. And by 2012 and 2013, we had commercially deployable tests for detecting bladder cancer in the United States and in New Zealand.
The mission of the company is really to try and minimise the impact of cancer on patients. And this can be done through either earlier diagnosis, better treatments, better management, management which is closer to home for the patient, so there's less burden on individual patients and at the same time getting better care.
Pacific Edge makes a number of different products for hematuria evaluation, triage for ruling out healthy patients and helping to send them home, detect for determining whether or not you have cancer and how serious that is, and a monitor product which is used in the surveillance setting for people who are post their transurethral resection and are in need of consistent monitoring for the recurrence of the disease. At a technical level, Cxbladder is a urine-based diagnostic test that uses 5 RNA or markers, so that's gene expression markers, as a mechanism for determining whether or not someone has cancer.
Then when we were able to use this technology of gene expression microarray and look at every single gene, 20,000 genes in a single experiment, it really changed the whole game. And so for me, it's been utterly remarkable to have access to phenomenal technology and really dig into the heart of cancer biology.
Messenger RNA by design is very labile. So this represents the expression of the genes. In order for genes to be regulated and turn on and off, their product, the messenger RNA, has to be degraded very quickly. When the urine is collected, it's immediately combined with our proprietary buffer, and that stabilizes the messenger RNA at ambient temperature for up to 12 days, which gives sufficient time to ship without any special packaging to our laboratory in Hershey, Pennsylvania. Our laboratory technologists, they are highly trained and they are very much involved in the process. But we also have incorporated robotic technology for all of the preparations within the PCR. So we do use robotics and we use them in a very smart manner, which allows us to do real-time monitoring through that process so that we can detect and also mitigate any errors that may occur during that. The other equally important aspect is that Pacific Edge has had commercialization in mind from the beginning. And what that means is that the test, as designed, really has to fit into the workflow at the clinic.
One of the areas of value, particularly for a test that can send healthy people home, is helping physicians optimize their practice. Like, who really needs my attention and who doesn't?
So in my practice, if I get a positive Cxbladder detector, Cxbladder monitor, and I have a negative cystoscopy, that puts me on high alert. That tells me that either I'm not seeing a cancer that's going to emerge, or I'm not seeing a cancer that's already there. So I'll be a little bit more aggressive in my workups. So it's a really easy test to run. It's just a voided urine sample, so it doesn't really change the workflow in the office. I think what's very novel about it, especially during these pandemic times, is that the test can actually be mailed to a patient and they can urinate in the cup at home and send it back to the lab. So the patients really understand the test and what it means. They like the fact that there's no more atypical cytology, that they're getting a result saying, yes, there's gene expression or there's not gene expression. They feel a lot more definitive that this is an objective test and not relying on a pathologist to look at the slides and look at the cells.
The vision of Pacific Edge is to improve cancer outcomes, as simple as that. And it's done through many, many different ways, partly through early diagnosis and therefore better outcomes, but also to improve the patient experience.
To commercialize technology that I think is just incredibly interesting from a scientific perspective, is an absolute privilege. We are improving the standard of care by offering tests with this kind of sensitivity, specificity, NPV. And with time and exposure to these tests and how they're used and additional education and utility associated with it, we believe that clinicians will increasingly choose to order this test.